10 exercises that send men over 40 years old to surgery room the most. When you enter a gym, with all that professional environment, modern equipment, and uniformed instructors, it's natural to think you're in a completely safe place to exercise your body. However, there's a reality that few people talk about. Not all exercises are equally safe for all ages. And mind you, I'm not saying that a certain exercise will necessarily send you to a surgery table, but there are movements that, especially after 40 years old, significantly increase the risk of serious injuries. And let's face it, many times it's easier for the instructor to be helping a female student on the treadmill than the guy doing bench press with completely wrong technique. That's why you'll see 10 exercises that most frequently take men over 40 years old to surgical procedures. And I'll tell you in advance, I bet at least 2 or 3 of these exercises are part of your current training routine. But before we start, please tell me here in the comments your name and how long you've been training. Exercise number 10, Dumbbell Fly. The Dumbbell Fly is almost a classic in chest workouts, and you've probably done or still do this movement. The problem is that it puts your shoulders in an extremely vulnerable position, especially when the arms are extended at the lowest point of the movement. When your arms are fully open, the tension on the shoulders is extreme. This happens because in the most open position, the torque on the shoulder joints is at maximum, while the pectoral's force production capacity is reduced. Over time, this repetitive overload can cause micro-injuries in the rotator cuff that, if untreated, evolve into partial or complete ruptures. And then, my friend, the path to the surgery table is paved. If you're already over 40, have a history of shoulder pain, or simply want to train more intelligently, replace the dumbbell fly with the machine fly. On the machine, the path of movement is guided, drastically reducing the risk of hyperextension of the shoulder joint. Additionally, the machine allows you to adjust the range of motion according to your individual mobility, something impossible with free dumbbells. Exercise 9. Front raise. The front raise is another exercise that I see many people over 40 doing regularly, usually with inadequate loads and questionable technique. And what makes the front raise particularly problematic is the combination of 3 factors. First, the movement places the biceps tendon under extreme stress when the arms are above shoulder level. Second, there is significant compression of the subacromial structures during the movement. And third, most people unconsciously use the trapezius to help with the movement, creating dysfunctional muscle recruitment patterns. Over time, this repetitive stress can lead to tendinitis, impingement syndrome, and even rotator cuff tears. The good news? You simply don't need this exercise. If your goal is to develop proportional and healthy shoulders, focus on shoulder press. If you really want to give extra attention to the anterior deltoid, remember that it's already being well worked in your chest exercises. The shoulder press, whether with a barbell or dumbbells, allows a more natural movement pattern and better distributes the load among the different portions of the deltoid, significantly reducing the risk of overuse injuries. Exercise 8. Leg press. The leg press. That machine that allows you to stack plate after plate, giving the sensation that you're lifting the world. It's one of many people's favorite exercises, especially those who have some lower back discomfort and believe that the leg press is a safe alternative to squatting. But here's the inconvenient truth. The leg press can be even more dangerous for your spine than a well-executed squat. Why? When you're on the leg press machine, especially those inclined at 45 degrees, your pelvis tends to tilt backward at the end of the movement. This puts tremendous pressure on the lumbar region, especially when you use heavy loads. A study published in the International Journal of Sports Medicine followed 340 weight training practitioners for 5 years and found that the leg press was associated with a 28% higher incidence of disc herniation compared to free squatting, especially in individuals over 40 years old. Additionally, the leg press creates a false sense of security that frequently leads to the use of excessive loads. I've seen countless cases of men proudly stacking 880 pounds on the leg press, but unable to correctly squat with 130 pounds. What do I suggest as an alternative? Go back to basics. The squat. I know it may seem intimidating, especially if you have back problems, but a squat with perfect technique and appropriate load is much safer and more efficient than a poorly executed leg press. A perfect squat with 88 pounds will bring more benefits and fewer risks than a questionable leg press with 660 pounds. Exercise 7. Behind the neck lat pull down. If there's one exercise that I would like to see banned from all gyms, it's the behind the neck lat pull down. This is possibly the most dangerous exercise on this list, and the most frustrating thing is that it continues to be taught and practiced in many places. The fundamental problem with this exercise is in the unnatural position it forces your shoulders to assume. To bring the bar behind your head, your shoulders need to perform an extreme external rotation combined with abduction. This position puts severe tension on the rotator cuff, particularly on the supraspinatus tendon, which is naturally prone to degeneration with advancing age. Additionally, for many people, especially those with a history of sedentary work, shoulder mobility is already compromised. Forcing this joint into a movement for which it's not prepared is like trying to fit a square key into a round hole. Something will give, and it's usually your connective tissue. The most ironic thing is that the behind-the-neck pull-down offers absolutely no advantage in terms of muscle activation. Electromyographic studies have repeatedly demonstrated that the front pull-down activates the back muscles with the same or even greater intensity without putting the shoulders at risk. The obvious and far superior alternative is the front lat pull-down, with a pronated grip at shoulder width or slightly wider. This movement allows a complete contraction of the latissimus dorsi without compromising the integrity of your shoulders. Exercise 6. Barbell bench press. The barbell bench press is practically a rite of passage in gyms. It's probably the first exercise you learned when you started training, and even today it's the standard answer when someone asks, "How much do you lift?" However, for men over 40 who don't have perfect technique in execution, which, let's agree, is quite common to see, this iconic exercise can represent a direct path to shoulder and chest problems. The problem with the barbell bench press is in the rigidity of the movement. The bar forces both arms to move in synchrony, following exactly the same arc of movement. This completely ignores individual anatomical differences. Think about it. Are your shoulders perfectly symmetrical? Probably not. Most of us have slight differences in bone structure, joint mobility, and movement patterns between the right and left sides. When you force these asymmetrical structures to follow a rigid and symmetrical movement pattern, you're creating ideal conditions for the development of tension points and premature joint wear. Therefore, it's best to replace it with the dumbbell bench press. This variation allows each arm to move independently, following its natural arc of movement. You can adjust the wrist rotation during the exercise, finding the most comfortable position for your joints. Additionally, dumbbells allow a slightly greater range of motion, resulting in better stretching and contraction of the pectoral. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will make you progress with health in the long term in the world of weightlifting. Exercise 5. Traditional sit-ups. Traditional sit-ups are practically synonymous with AB workout in many people's minds. It's that exercise that everyone has done at some point, usually in endless series in the hope of burning belly fat. A myth, by the way, that we should have overcome. The problem with this exercise is not just its inefficiency for developing a defined abdomen, but mainly the stress it places on the lumbar spine. Each repetition of traditional sit-ups subjects your spine to significant compressive force, especially when performed with the feet secured under something, as we often see. Biomechanical studies from the University of Waterloo, led by Dr. Stuart McGill, one of the world's leading spine specialists, have demonstrated that traditional sit-ups can produce compressive forces of up to 3,350 newtons in the lumbar region. To contextualize, this value approaches the limits recommended by the National Institute for Occupational Safety and Health for young and healthy workers, and certainly exceeds what would be prudent for older men, especially those with any history of lower back pain. Furthermore, the typical execution of traditional sit-ups involves repeatedly flexing the spine, exactly the type of movement that, over time, can contribute to the degeneration of intervertebral discs and eventual disc herniation. It's like bending a paperclip several times until it breaks. The plank is probably the best exercise to replace traditional sit-ups. It works all the core musculature in an integrated way, strengthening not only the rectus abdominis, but also the obliques, transverse abdominis, and spine-stabilizing muscles. All this without subjecting your spine to compressive forces or repeated flexion cycles. Exercise 4. Pec Deck. At first glance, it seems like a controlled and safe exercise. After all, it's a machine, right? Unfortunately, the reality is more complicated. The main problem with the traditional Pec Deck is in the position of the arms and shoulders during the exercise. Most of these machines force your arms to be abducted at a 90-degree angle, with the elbows also flexed at 90 degrees. This position, combined with the internal rotation of the shoulders that naturally occurs during the movement, creates the perfect scenario for subacromial impingement, a condition where the rotator cuff tendons are compressed against the acromion. Over time, this repetitive compression can lead to inflammation, tendon degeneration, and eventually to impingement syndrome, one of the most common causes of shoulder pain in older men. The risk is even higher for those who already have some degree of shoulder arthritis or a history of previous injuries. Another problematic aspect of the Pec Deck is the fixed nature of the movement axis. Unlike exercises with free weights, where your body can naturally adjust the trajectory of the movement to accommodate your anatomical particularities, the machine imposes a predetermined trajectory that may not be ideal for your specific structure. The Pec Deck movement also places significant tension on the anterior shoulder capsule, especially in the maximum opening position. For older men, whose connective tissue no longer has the same elasticity of youth, this repetitive tension can result in micro-injuries that, over time, compromise the stability of the joint. The safer and equally effective alternative is the modern design machine fly. Unlike the traditional Pec Deck, these more recent machines generally allow adjusting the angle of movement and have a path that respects the natural biomechanics of the shoulder, allowing some degree of external rotation during the exercise. Exercise 3. Behind the neck press. The behind the neck press is another exercise that should be left in the past. This movement, popularized in the golden era of bodybuilding, continues to be practiced by many, despite clear evidence of the risks it presents. To bring the bar to the back of the neck, your shoulders need to perform external rotation beyond the comfortable range for most people, especially those with decades of joint wear. This position puts severe strain on the rotator cuff, particularly on the supraspinatus and infraspinatus tendons. Over time, this repetitive strain can lead to tendon degeneration, chronic inflammation, and, in more severe cases, to partial or total ruptures. Additionally, the behind-the-neck press increases the risk of subacromial impingement, a condition where the rotator cuff tendons are compressed against bone structures during arm movement. Another rarely discussed aspect is the stress that this exercise places on the cervical spine. To accommodate the bar behind the head, many people unconsciously project the chin forward, altering the natural curvature of the cervical spine. This compromised position, especially under load, can contribute to neck problems in the long term. The obvious and far superior alternative is the front press, either with a barbell or dumbbells. This exercise allows working the same muscle groups without putting your joints in compromising positions. The dumbbell press, in particular, offers significant advantages. It allows each arm to move independently, following its natural pattern of movement, and facilitates a neutral or slightly external rotation of the hands, reducing stress on the shoulders. Exercise 2. Deadlift. Few movements recruit as many muscles simultaneously or have the potential to develop functional strength like it. The main challenge of the deadlift is in the technical complexity combined with the potential for using very heavy loads. It's a dangerous mixture, especially considering that most men over 40 already have some degree of disc degeneration, even if asymptomatic. A single lift with inadequate technique can be the catalyst that transforms this silent degeneration into a debilitating disc herniation. Research shows that, during the deadlift, the compressive forces on the lumbar spine can exceed 10 times body weight when significant loads are used. To contextualize, in a 176-pound man performing a deadlift with 330 pounds, the compression in the lumbar region can reach impressive 8,000 newtons, well above the limits recommended by the National Institute for Occupational Safety and Health. Besides compression, there are shear forces, which occur when the spine is not maintained in a neutral position during the exercise. These forces are particularly harmful to the intervertebral discs and can significantly contribute to injuries such as disc herniations and spondylolysis, a condition characterized by stress fracture in the vertebrae. As I mentioned earlier, it's difficult to find a perfect substitute for the deadlift, given its unique muscle recruitment profile. However, there are alternatives that can provide similar benefits with less risk. If you decide to keep the deadlift in your program, consider some modifications. Significantly reduce the load. Working with 60 to 70% of your maximum can provide most of the benefits with a fraction of the risk, and always prioritize perfect technique over load progression. Exercise 1. Diamond push-ups. Diamond push-ups, that exercise where you position your hands close to each other, forming a diamond with your thumbs and index fingers, are often prescribed as an intense variation to work the triceps. The main problem with diamond push-ups is in the extreme position they force your wrists and elbows to assume. The position of the hands, close and internally rotated, places significant strain on the wrist joint, particularly on the scaphoid and semilunar ligaments. Over time, this repetitive strain can contribute to joint instability and even carpal tunnel syndrome. Additionally, the hand position causes the elbows to move away from the body during the movement, creating a working angle that significantly increases pressure on the shoulder joint, especially on the anterior portion of the joint capsule. The most frustrating thing about diamond push-ups is that there are dozens of alternative exercises for the triceps that are more effective and significantly safer. Why take the risk when there are so many better options? The triceps pushdown is probably the safest and most effective alternative. This exercise allows perfectly isolating the triceps without placing excessive stress on the wrists, elbows, or shoulders. We can also mention the French press and the skull crusher. Therefore, there is absolutely no reason to include diamond push-ups in your training program if you have access to these superior alternatives. If you liked it and also want to discover 10 common mistakes people make when taking creatine and that transform one of the best supplements on the market into poison, we left a video appearing right now on the screen. Don't forget to check it out. Thank you for watching until here, and may God bless you, my friend.